Keakabetse, and I'll be presenting on behalf of the Botswana team. And my presentation will be looking at use of systems thinking and systems thinking tools to understand and improve the coordination process at DHMT level. Slide. So, looking at the Botswana health system, we have undergone a transformative restructuring process recently, and we are trying to move from a centralized to a more decentralized system. And as it has been argued by different authors, whether initiated or forced, transformation requires a shift in perception and also the patterns of interactions in terms of internal and external stakeholders. And based on this understanding, our project is anchored primarily on applying systems thinking approach to the DHMTs with an attempt to change their mindset on the transformative process, and also try to identify the systems challenges that may be experienced through the process and attempt to address them also collectively in the process. So, as it is typical of complex adaptive system, the initially conceptualized transformation experienced a lot of unintended consequences, where there was a lot of resource resistance from the implementers of the transformation process, and also limited resourcing, as well as capacities for people to really move with the decentralization process. And moreover, we had individuals getting into self-preservation mode and thinking in silo mentalities of their units or their departments, and therefore not having a bigger picture of the system. So next slide. So with this systems thinking, which we understand to be implemented in volatile, uncertain, complex, and ambiguous environment, we looked at how can we then support the DHMTs to work through the initially initiated transformation process, but also, as the system is ambiguous, we had the advent of COVID-19, which totally changed the landscape from an initiated change process to a now forced process. So the question that we should be asking ourselves as the audience is the pandemic a threat or an opportunity to the health system? And this is the question that we'll be looking at when we get to the Q&A session, to together look at this as a threat or an opportunity. Slide. So in terms of our entry as the Botswana team, we are currently working with 2 DHMTs, one in the city and the other one in the outskirts of the country. So we introduced the project through the process of a tool of social network analysis, which basically at a very superficial level, we're looking at how can we understand the structure of the DHMT and also understand the interconnectedness of the actors within the DHMT. And we're looking at this using Liebel's good governance conceptual framework, which was also aligned to the building blocks of the health system. Slide. And we also looked at, as part of the tools of understanding the DHMTs and the actors therein, we applied the SWOT analysis and more of a hands causal SWOT analysis, where we looked at the conventional SWOT analysis, looking at the strengths, weaknesses, opportunities, and threats, but also tried to juxtapose the weaknesses and the threats with the strengths and opportunities. So basically, we were looking at if we have a weakness which came out of the discussions, like a demotivated staff, how can we use a strength like teamwork, which also came out of the presentation, to be able to facilitate change? If you look at the opportunities, we have decentralization as a process that is ongoing. How can we then use a decentralized approach to address disease outbreaks like COVID-19, for example? So we're looking at all this SWOT analysis and using the strengths to counter the weaknesses and the threats that may be coming to the system. Next slide. And out of the SWOT analysis, we were able to find a lot of challenges that the system was facing. And we had to apply another tool, which is the prioritization matrix, because we could not, as a project, handle all the challenges that were coming from the system. So we had to prioritize. And we used the Eisenhower prioritization matrix to look at which challenge should we see as more important and urgent, and how would that challenge sort of affect all the building blocks of the system. So coordination mechanism emerged as a priority challenge from that filter process. Slide. So we then looked at coordination mechanisms and wanted to look at it more closely and did a root cause analysis using the fishbone tool. And one, we wanted to identify the cause and effect at both higher level category and sub-level categories of the causes. And also, I must mention that this was quite an ideal tool for us, which is something that we learned through the reflective practice, because it was able to really engage participants and also utilize their knowledge of the process, because we were coming more of as an external facilitator. So we were able to really use their knowledge in terms of the processes and the issues and the attributable causes to the delay in the whole process of transformation. And like I said, some of the things came because, next slide, because of the reflective practice, which is also one of the tools that we are engaging in. I would go to the next slide, we'll come back. Yes, we are using reflective practice, which is also, we adopted our reflective practice, sort of adopted the purpose taxonomy of reflection, where we look at, after engaging the DHMT, how much of it are they able to remember? How much did they understand? Are they able to see themselves applying all this information at the DHMT? How do they see it once they evaluate it? And are they able now to come up with innovative ways of ensuring that systems thinking is becoming a norm within the DHMT? So as I was saying, you can go to the previous slide where we were looking at the root cause analysis. And we were looking at the issue of poor coordination mechanism and some of the key issues or the categories that were coming forth. As you can see, we had poor work ethic, we had communication channels not followed, unclear operational structures, and all that. But because of the reflective practice, we go to the 2 slides after that. Another, okay. We realized that with the fishbone, we were able to see, and this is where we see reflection at creation or analytical process, where we see a lot of themes coming together, and it gives us a good leeway to realize that once we start addressing the causes that have been identified, we are likely to even kill, as people say, kill more birds with just one stone, because there are themes or patterns that we start seeing in the fishbone. As you see the colors there, that means that those are thematic areas that we will be able to address just by addressing one particular process. So go to the next slide. Nope. Before that, oh no, that's fine. Okay, the next slide. Yeah, so part of the next processes that we are looking at, we are looking at ensuring that we also now look at the root causes, and now try to take them through the process of business process mapping, where we would now take a thematic area and try to address it in terms of how it flows in terms of developing interventions. And I would say where we are now, we have probably looked at some of the initial 3 steps, and we'll be now going into the last 2 steps, which is improving the process and planning for change. But I think this would be more of a rigorous exercise that we work together with the DHM team. And the next slide, and also one of the interesting tools that we are looking forward to using is the causal loop diagrams, to try to analyze and visualize the interactions and relationships of the different system actors in terms of in the challenges that we have identified, which ones are seemingly reinforcing the transformation process and which ones are balancing the transformation process, so that we are able to know which one to focus on and how to also reflect on those that we see to be hindering the process. And this is something that we are also getting from the literature, as you might have seen Karim's paper on causal loops. The next slide is basically the comment and the learning points that we are continuously getting. We realize that systems thinking is really vital in understanding complex and highly interactive and unpredictable health dynamics. And there is need to adopt multiple tools and approaches in addressing systems thinking. And also participatory approaches are quite helpful, because as we learn by doing, it's easier now to change people's mindset. We don't even have to seem to be imposing. People are already changing the mindset. And I would like to thank you very much and indicate that as we are carrying our own smaller blocks, we are starting to see a bigger picture in terms of adoption of systems thinking within our DHM teams. Thank you.